Okay, let's get this started. I'd like to welcome you all to our distinguished lecture, which actually is a Distinguished Lecture Award. This year our award goes to Dr. Joe Farrell. I asked Joe to give me a short resume so I could introduce him. So please buckle up. Joe received his Certificate of Physical Therapy from Northwestern University in 1976. Who was born after that? Postgraduate diploma in manual therapy from Curtin University, Perth, Western Australia, 1979. Joe is of the generation where you had to leave the country and really work hard to get this education. He got a Master's of Applied Science, Health Sciences from Curtin University of Technology in Perth, 1981. Doctor of Physical Therapy, Massachusetts General Hospital Institute of Health Professions, Boston University, 2007. The man does not stop. Professional things, senior faculty, Kaiser Permanente, Northern California, Orthopedic Manual Physical Therapy Fellowship for over 30 years. Private practitioner owner in Redwood Orthopedic Physical Therapy, Castro Valley, California, 1984 to the present. He's been executive committee member for AAOMPT, 1996 to 2000, as well as at the APT and orthopedic sections as a director from 1997 to 2003. As you know, he is one of our founding fellows for the Academy and the very first president of the American Academy. And I spent a little time under his direction as executive. It's very entertaining years. Exceptional heavy lifting from Joe early on. He has served as on many AAOMPT committees, including Practice Affairs, the Ethics Committee, and is currently in the Program Director SIG. He's a published author, invited speaker at the state level, the national level, and international levels. Oh, long list of awards. We can throw this one at the bottom. Paris Distinguished Service Award from the Orthopedic Section in 1995. Founding Member Award of AAOMPT 2001. The John McNell Service Award from AAOMPT in 2011. Northwestern University School of Physical Therapy Distinguished Alumni of the Year Award 2014. And then this award is listed, and the Fellow Award from the APTA is known as the Catherine Worthingham Fellowship Designation Award, which he received as well in 2015. I'm going to stop there because there's too many pages, but what a career. Joe. Your last one is a been there, done that ribbon. And not my idea, diva. Congratulations. It's all yours. I'll be back.
Yeah, you bet. On August 9th, 2008, I died. That same day, I came back to life. I started to realize I thought differently about the world, since I was gradually awakening from a 3-day coma, which was due to sudden cardiac arrest. Or for the medical doctors called it sudden death syndrome. Think differently. It's going to be my challenge to each and every one of you today. I'm going to relate a personal story to how the Academy started and how in the early days of the Academy, the founders thought differently. And I think we need to keep thinking differently forever. people who think differently, they're uncomfortable with the status quo. They push the edge of the envelope hard and constantly. They love to beat the odds. They are risk takers, and they never give up. I think those of you know me. I never give up at anything. I could tell you a bunch more stories about this, but I would go on my 50 minutes, and I can't, but I may slip one in later. So you're going to hear me and witness me during this presentation, pushing the edge of the envelope hard. And I hope I push you all to think differently. So my story begins in August of 2007. I was playing golf with 3 other very close friends from Incline Village, Nevada. We were on the championship course. It was a beautiful day, and God, I was only 6 over making the turn. I mean, I'm feeling good. I'm hitting the ball. It was a beautiful morning, and I get up to the 11th tee box, and I sliced about 260 onto the 12th fairway. And I kind of went, oh, there goes my round. And then I thought, too many people on this course. I'm going to push on. But my close buddy, Bill Dupin, said, Joe, come on. Let's go try to find that ball. Let's see what we can do. So we drove onto the 12th fairway, and we looked up to the right, and on the green was a man lying there, and he was out cold. He was blue. There was another gentleman attempting to do CPR on this man, and unfortunately, he didn't know what he was doing. So I started screaming at Bill, my buddy. I said, Bill, call 911, quick. We were the only ones that had a cell phone as far as I could tell around the area. And I said, by the way, get a helicopter in here, because the closest hospital is Reno, Nevada. And those of you that have been to Lake Tahoe know that's a good hour drive. This guy was in dire straits. I started CPR, and I didn't know if he'd make it. I was screaming, what's his name? What's his name? His name was Frank. What happened? And I'm just pumping on this guy's chest, and I'm trying to count 30, and I'm blowing at his mouth at 2, and the 30 to 2. You've all been trained. By the way, I hope you all keep your training up. So this guy, he was out of it. I was out of it once. As blue as this coat this guy was. So all of a sudden I hear sirens. And the sirens got closer and closer. But there's no paramedics. Where were they? And I'm starting to scream at Bill and my playing partners, and Bill goes, oh my God, they're at the 12th tee box, not the 12th green. So Bill sprints down there, and Bill's 10 years older than me. He's, at the time he was, 66. I was 56 or 55 at the time when this happened, and I'm saving this guy. He sprints down there, get the paramedics up, and they approach the scene. If you've ever been in this situation when you're performing CPR on someone, the paramedics move slower than molasses. And I'm going, damn, I'm at 7,200 feet elevation. But I didn't feel fatigued at all. I could have gone on an hour with this guy because I didn't want to lose him. I wasn't going to give up. The paramedics stroll up, and I'm thinking, okay, well, they'll take over. No, keep it up, keep it up. So, they're moving around my hands, putting on the AED pads and all that, and keep it up, keep it up. And then all of a sudden I hear, don't touch the patient, which is what an AED says, because it's checking the rhythm. And all of a sudden, bam, this guy they must have shocked him 5 times. And I'll be damned, he started to breathe. I never thought that this would happen because he was in really dire straits. So I go off to the ambulance with the fire chief, and I clean my mouth, I clean my hands. And the fire chief goes, I think you saved this guy's life. I go, let's hope so. And up comes a helicopter. Wrong spot again. Can you believe that? And there's Bill sprinting down, man. I thought Bill was going to have a cardiac arrest. Bill sprint out, and actually, that's an actual. I got that on Google, image, but that's an actual CalStar copter that came in Northern California, so that is legit. So, Bill gets him in there, and the copters just all these people are cruising around, and here's old Frank on the stretcher breathing. He's still in a coma, and he gets whisked away. And again, the fire chief, he's going, man, that guy's lucky that you were around. And that's the wonderful thing about CPR, is that if you're not alone, you can save a life. And I'll go into more of that in a minute. So let's fast forward. Let's fast forward to August 9th. Pretty important date in my life. A date I'll never forget, even though I don't remember a darn thing. I was at a very close friend's home, PT physical therapy friend in Rockland, California. I was talking to two very close friends, and I passed out. And this, what I'm telling you, I didn't know happened, okay? I just went out. This is Edie, my wife's recollection. So this gentleman, Matt, who was a track coach, who coached my good friend's daughter in track, started pumping on my chest. And there's this guy named Vern who is taking my pulse. And every compression, Vern says, I got a pulse. I got a pulse. And they kept doing this. And of course they called 911. I forgot that part. But I'm in a zone. I was on the other side of the wall of death. And if you've ever been there, you don't remember. I didn't see the light. But it's a pretty unnerving deal. So the paramedics came. I don't know how many shocks I got. Edie thought 7. And I started to breathe. But she left the room because she couldn't stand to watch it. Would you blame her? Pretty damn tough. So I get transferred to Roseville Sutter Hospital. And Edie and Matt, the gentleman that did CPR on me, were following me. And a number of other very close physical therapy friends showed up at the hospital also. So I made it through the ER, cath lab, and my arteries were clear except my anterior descending artery, which had only a 20% occlusion. Pretty lucky for 56, And the cardiologist was going, God, I can't believe he didn't have a heart attack. Comes out and talks to Edie and my best friend John, who was there supporting her, and said, he didn't have a heart attack. He had a cardiac arrest. There's some reason he had a cardiac arrest. He's got an electrical problem in his heart. We don't know why his potassium dropped out to nothing. We don't know. That was a medication. I researched it, so I'll fast forward a little bit, but I found out 9 months later it was a medication I was taking, and that 0.1% of the population, the ACE inhibitor, would cause potassium to drop enough to cause cardiac arrest. How's that for bad luck? All right, I got to figure something out here. Excuse me a second. Because this is an important part of the story. So, I'm still in the cath lab, and sorry about that. I went into arrest again. More shocks. 2 times in an hour, cardiac arrest. So, I go into ICU. I underwent 24 hours of hypothermia to protect my brain. And, of course, I still don't remember anything. But if you can see in this picture, it's pretty rough. Being hooked up to everything. You don't know what the hell's going on. Your family doesn't know what's going on. And my wife, we met at Mass General Hospital. And she was a chest physical therapist and worked intensive care for a year. Edie knew the scenarios, and they weren't good. The first 48 to 72 hours, you don't know if you're going to make it. So the first scenario is you die. The second scenario is you have severe enough brain damage because of the anoxia from the cardiac arrest that you go to a long-term rehab facility forever. The third scenario is you have subtle brain damage and you go to rehab. Or the last scenario, which as you can tell, I'm here, you survive. So I had a defibrillator put on my chest 4 or 5 days later, and I left the hospital. Thank God, with a relatively normal brain. I said relatively. So it's not over yet. It's not over. So my wife and daughters drove me home, back to Danville, California. And I want to tell you, the first 2 weeks for me were very hard. But you just can't imagine how hard it was for Edie and my daughters and Jenny and Shannon. Jenny and Shannon, they can't talk about it to this day. It's 7 years ago. They can't talk about it. It's too hard seeing me hooked up in tubes and all that kind of stuff. Okay? But I had a rough 2 weeks. I was fatigued, trying to recover from intubative pneumonia. I had such low blood pressure, I couldn't stand up out of the chair and pat John on the back. I'd almost pass out. So Edie got me into my cardiologist. We got the medications all set up. And finally, I started to feel better after a couple of weeks. But I'm telling you, I think I slept like my dog Mick 18 hours a day because I'm recovering from cardiac arrest. So, as I recovered my brain, which I think took about 30 days. What do you think, Edie, about that? You said it was forever, but no. We started talking about, what had happened. And we said, we have to do something because I saved a guy's life almost a year to the day I had my cardiac arrest. We said, we have to do something, and that, it's no coincidence that this happened to me. Whoever you believe in upstairs, that's what I believe was watching out for me and for Frank, and said, you got to do something different. You have to make a difference in the world, especially where you live, because the number one killer in the United States of America is sudden cardiac arrest. 400,000 people die every year of cardiac arrest. Did you know that's more people die than all cancers combined? And by the way, this is National Sudden Cardiac Awareness Month. I want you to know that. Ladies, I'm sorry. It's supposed to be Breast Cancer Month too. 400 people die a year. That's more than all cancers, AIDS, gunshots, car accidents combined. That's a lot of people. And only 8% of those that have an out-of-hospital sudden cardiac arrest survive. That's not many. I'm kind of in a pretty closed club. I thought I was in a pretty cool club 25 years ago when we started the academy. Well, I'm kind of in a cooler club now. I'm in 2 clubs. I got 2 different I got 3 families now. That's a lot of people. So we decided, hey, look, we need to do something. So I met one of my good friends who coached my daughter in soccer, my youngest daughter, Shannon. And I said, Tom, I got to do something. Edie and I got to do something. Our new goal in life is to save people's lives, to prevent death, or prevent heartache too, so people don't have to go through the loss of a loved one or a friend or a family member. So he said, why don't you meet the mayor of Danville? So I called up the mayor, got a cell phone number, and he goes, hey, Joe, I heard you had a rough couple of months. And I said, yeah. He goes, let's go for coffee tomorrow. Okay. So we go out for coffee, and he goes, tell me your story. So I won't bore you with that again. So you're not bored, are you? Did I get your attention? I did, didn't I? There's a reason I started this way, besides education, you know. Newell had a heart attack on August 9th, 2004. If you recall, I had a cardiac arrest on August 9th, 2008. Can you believe that? I mean, there's more than coincidence here. Yeah, wow. So we immediately bonded. He goes, I want you to come to the mayor's breakfast this Friday. And at the breakfast, you're going to meet all the town council members. You're going to meet the fire chief, Rich Price, and you're going to meet Captain Swartzel, who's the chairman of the Heart Safe Committee of the San Ramon Valley Fire District. I said, okay. This is the first time, besides talking to Newell, that I told my story. So, the man in this picture, who I have my arm around, is Captain Andy Swartzel. And Captain Swartzel is the chairman of the Heart Safe Committee. The people pictured in this photo, there's 12 of us, and you can see Edie up there on the upper right. We have trained 13,000 people in hands-only CPR in the last 3 years. Really 14, it's gone up. We just treated another 1,000, or taught. We have been responsible for putting AEDs in every school in our school district, every police car, and a huge number of buildings in our area. We have been responsible for getting into the curriculum in the 7th graders, and there's 3,000 7th graders, hands-only CPR and how to use an AED. This is our 3rd season. I go by seasons now. So every year we've taught 3,000 kids. Why did we do this? Because Edie and I said, you know, we got to change. We got to think different. We got to push. We're going to teach as many people CPR as we can. And I'm not even counting the number of people we've taught as healthcare professionals and at all kinds of fairs we go to. And, you know, I'm a 5 Advil guy after I teach all day and at a fair because I'm on my knees for 6 or 7 hours teaching CPR. But, you know, it doesn't hurt because I'm here with you. And I'll give you a stat. This is why numbers matter. We taught 13,000 people in CPR in 3 years. That's a lot of people. But you know what happened? In our community in the year 2013, there's 190,000 people in the San Ramon Valley. The witnessed sudden cardiac arrest survival rate was 32%. The national average is about 20. In 2014, our witnessed sudden cardiac arrest survival rate was 80%. That's better than Kane County near Seattle, Bill. They're the legends in sudden cardiac arrest, resuscitation, survival, and research in the whole country, Seattle, Washington. We're higher than them. Dr. Sarah can't believe it. He's their leading researcher, but it's true. We showed him the data, and it's legit data. So, can you see why these numbers matter? All right? The numbers matter because in our academy, our membership's not growing, is it? I'll show you. Oh, I'm a little ahead. We need to thank someone. Dr. Freddie Kaltenborg, 92. Can you believe that? Wow. Freddie brought the 8 founding fellows together 24, almost 25 years ago at Rochester Hills, Michigan, at Oakland University. These gentlemen, and one lady in this picture, Mike Rogers, myself, Ola Grimsby, Cornelia Kulig, Stanley Paris, the late Dick Earhart, Bjorn Swenson, and not pictured Michael Moore were thinking differently when we founded this organization. This organization was founded based on 3 principles: compromise, collaboration, and partnerships. And I understand there's 5 new fellowship programs that have just been approved by ABTRE. I hope all you new members, new fellowship programs, don't forget the history of how this organization was founded. You are now privileged to be in our family. Family members watch out for each other, and there's certain protocol. And I share this with you because it comes from here. Okay? But all those 8 people were thinking differently. And we started out, there was 3 reasons why we started the academy. The first was to get into IFOM. The second was to form an accreditation body to improve education for our country. And the third reason was to get a place where we could confer and meet, like we're meeting here. That's pretty cool. But you know what? The APTA didn't like it. They thought we were rebels. They thought we were self-centered. They thought all we wanted to do was make a bunch of money and get our names up in lights. No, that wasn't the reason. The reason is we were thinking differently. We wanted to improve the postgraduate education in the United States of America because we thought our current graduates were not prepared to meet the demands of the healthcare arena, and this is 1991, almost 25 years ago. The APTA was very upset with us, and because no one had challenged them. They thought, who are these people? They're pushing against the grain of what we believe in. Well, you know what? We weren't going to sit back. We weren't going to give up. And have a drink with Mike or I tonight, and we'll tell you some stories that'll turn your hair white and curl it about those days, because he was on the phone with me probably 2 to 3 nights a week for 6 months to a year after I negotiated with Jan Richardson and Marilyn Moffat. There were some late nights. Mike calmed me down immensely. So did Edie. Thank you, Edie. Because I wasn't going to give up, and nor were the founding fellows, on getting our way. We wanted an organization based on collaboration, compromise, and partnership. We had our goals. We weren't going to give up. So what happened? If you were there in 1992 in San Francisco, California, at the combined section meeting, we stacked the room. And we passed a motion with the help of Jan Richardson to work in collaboration. Word collaboration is pretty important. Another important word is no coincidence. The other couple words are numbers matter. We'll get to those. And we passed a resolution, and that led to the formation of us getting into IFOMP. And I want to thank Jan for that. That was hard for her. So, you're thinking, Joe, we've grown immensely from 8 residency programs, and if you do the math there, to 217 residencies and fellowships since in the last 25 years. That's pretty awesome, but I don't think it's good enough. I think we need to get residency and fellowship programs of all disciplines in every university DPT setting, every one. We've got to do it. My plea to you as members, every one of you in this room is a member, even you students. Thank you for coming, students. I want to give you students a shout out because you're going to be the leaders someday standing up here, hopefully giving a speech or two, because it's important that you stay involved. We must also consider us still a political force. We can't be a yes organization. We have to be in control. That's what we started out in. That's why we are an alternative organization to the APTA. Now, we've agreed to be members of APTA now. That's cool. But we still have to be remaining a political force, and I need your help. So does the executive. Because that's part of our evolution. We have to continue to evolve, because if we don't, we're going to be satisfied, and I hope we never are satisfied with the status quo. Remember, thinking different, you're never happy. You're never comfortable with the status quo. So, to maintain our influence, we need to grow our membership. Numbers matter. Think about my personal story. 13,000 people trained in CPR. Helped raise the sudden cardiac arrest survival rate from 32% to 80% in 3 years. This is common sense. I don't have a degree in mathematics or statistics, but the probability, if we have increase our membership, we're going to have more members to influence our profession. And I'm not saying APTA is an enemy. They're our friends. But we have to push to improve our education. That's why I suggest let's get residency and fellowships in every university setting. So here's the numbers. My source is our membership committee. So if you look at the numbers, we're not really growing in the past 4 or 5 years. We're stuck at the blue line is at about 2,000 since 2011, and we've gone up to 2,200 members, okay? That's an 11% growth in membership. Not great. The pink denotes the number of fellows. We grew 33% as fellows. I don't say we, I am a fellow, but, that's pretty cool. But I don't think it's good enough, especially when over the past 10 years, some 30% of the fellows did not renew. We have to make that better. So, why do we need to grow our membership? I want to offer you a simple template that you can sell. We have to sell now. Each one of you out there has to sell the value of our organization, okay? We need to continue to be a political and clinical force. And notice I'm saying not just nationally, but internationally. We need to foster our relationships, make them stronger with our professional associations and IFOM. We need to stimulate, I keep saying this, but I mean it, it's in special color for a reason. We need to get residency and fellowship programs in every university system of DPT education. We need to continue to exchange professional information and network professionally. That's what we're doing today. And as Jim Rivard said, if this is your first meeting, I hope you come back year after year, because I see a lot of familiar faces. I see one person that was here 20 years ago, and we'll talk about that in a minute. So listen to this quote here, okay? Believe it or not, being from the state of California, this is going to shock you who this quote came from. It's from a Republican state senator, Mimi Walter, and she states, being meaningfully engaged in the political process means exercising your right to support individuals who share your philosophical views. Raising your level of participation can mean the difference in electing a body of legislators that are knowledgeable about the issues facing your profession. The key word there is participation. I challenge you. Don't be timid in your level of participation in the academy. Let's raise it up. Let's all step up. We have to be passionate to grow the organization. If you don't have the passion for the organization, get it. Meet someone who's passionate in this room. And I know a few hundred. We got to work together. Members, board of directors, program directors of fellowships, all the committees. We have to work as a team harmoniously with tremendous energy to meet the numbers challenge that I will pose. So this is how we're marketing right now, really, our membership, our benefits. And if you really look at it, I only put the differences between a member and a fellow. So a fellow can serve on any, committee, lead it, whatever, be on the board, where a member can only be a server on the board as a member of large. There's no voting rights for a member on IFOMP and educational issues. I think when we look at this number, look at all the members in blue. This is why we need everyone, not just the fellows, to push to grow our academy. And if you look at this little pie chart, I kind of like this. What's the biggest portion of the pie? It's passion. Secondly is mentoring. How many of you mentor people? I hope you do it, because you're the backbone of our organization. We got to volunteer. But those three things are really, really important. There was a saying that I utilized over and over when I was negotiating with Jan Richardson and Marilyn Moffett 25 years ago. And this is what we need to do. We need to walk down the same street in the same direction for the good of the profession and do this worldwide, not just in the USA. This is a picture that I treasure. This is a picture of many of my colleagues from the fellowship program I teach on and graduates. But this is taken at a retirement party for Carol Jo Titchener. And I put it up there because there's a lot of fellows there and there's a lot of faculty members there. And the reason I put it up, give a little shout out to my group there and Carol Jo. The reason I put it up is you don't have to be a fellow to be involved with this academy. Members are as important or more important. So, remember we wanted to get into IFOMP initially, and we did, and we wanted to, have an accreditation body. We got that now through ABTREE. We wanted a place to confer. We got that, and then our bylaws, we said we want to advance the profession, to establish uniform standards. We have improved on that immensely. We're still a member of IFOMP. We want to, get good public information out there. We want to recognize skill, management, competence, and dedication to the profession. We want to foster a free exchange of information amongst our members. And lastly, we have a strategic plan done 5 years ago. Great. We're due for a new one, right? Exactly. I hope. But in our strategic plan, we don't have a membership goal. Our last strategic plan called for, let's use social media to increase our membership. Well, in the last 5 years, we need to reassess. As a clinician, we're constantly reassessing. Is it working? I don't think it's working right now, but we all need to pitch in to make it work. If we increase our membership, we will likely increase and improve the education of PTs in our country and stimulate the growth of fellowship and residencies throughout the United States. This will help our patients, because if we have a higher skill level, they get better quicker, right? I mean, the research is starting to show that now. It's not equivocal, but it's getting there. Maybe we should say experience matters. It does. But think about how we can influence our patients, and they judge us. If we're better at what we do, won't that be great? Won't it be great when the day comes, and I hope when this is in my lifetime, when I go to a cocktail party and I stop hearing about people talking about their chiropractor for their back problem? Won't it be great when we say, hey, I got this great physical therapist, over there in Gulfport, Mississippi, and he's a rock star, right? Mike, I had to put that in there. I'm seeing some people nod. I got to get going here. So 20 years ago, first meeting, take a guess how many people we had at our first meeting at the Flamingo Hilton. Huh? 70? How many? 110, according to Mike Rogers. I asked him last night. I'm still changing my speech, even last night. That's a lot of, that's pretty good, the first shot. Today we have 600 and what? 60? Something like that? So just think, if we get more members, maybe next year we'll have 900. Let's think about that. Okay? So, we got to volunteer. Each one of you in this room needs to volunteer. You can't be passive like these two lions. This is at 5:30 in the morning in Kenya. They're just getting up. Okay? You got to think differently about your membership now. You can't coast. I don't want any of you to coast anymore. Right? It's nothing worse than coasting. Push yourself a little bit to be involved. All right? I want you also to think about mentoring younger clinicians, even at your clinic. So, we talk a lot about mentoring. This is Dr. Lance Toomey, one of my closest friends and mentors. He not only taught me how to write, how to research, gave me a few tips on politics and being a good person, but he taught me how to volunteer professionally. We need to mentor our fellow clinicians and new people in our organization to be involved professionally. Don't just sit back and let someone else do it. That's what we need to mentor. So, how many of you read the fellowship renewal document that came out 3 years ago? Not many hands. That's not good. I was on that committee, and I really enjoyed myself. We had some great conversations, and there was many people in this room on that committee. But we redesigned what it took to become a fellow related to patient care, educational development, teaching, scholarly activity, professional service to volunteer. We made scholarly activity a little easier so that you, as a clinician and a busy clinician, can meet the requirement. We made the hours a little different. We also say, you know what, 2,000 hours isn't much to work in 10 years, is it? But we have some very valuable people in this organization that are clinical faculty at universities that's hard for them to meet. So we changed the fellowship requirement that you have to meet 4 out of those 5 domains in a 10-year period of time to renew your fellowship. Now, I'm going to throw a little curveball at you. Do we need this? Do we need fellowship renewal? Think about that. There are some professions, the medical profession, once you're a fellow, you're always a fellow. So I challenge you that. What do you think? You don't have to tell me now, but I think it'd be a good discussion. So I want you to get involved with the committee, okay? I have heard that the academy limits the number of members in committees, to 4 to 6. Now, understand that's the core, right? I respect that, executive, all right? But that's not enough people in a committee. I see some people looking at the floor right now. Oh, he's talking about me. Got to be involved, huh? Well, you do. So tomorrow, between 3 and 4, there's a come and see thing, where you can learn about committees. And I urge you all to go to 1 or 2 of those meetings. Here's our 9 committees. Today, I want you all to join the membership and media committee. Trent Richardson, you owe me a case of Cabernet Sauvignon for this. Where is he? Is he here? He's not here? Oh, my God. Where is that guy? Huh? Sorry. You're here. You owe me a case of Cab. You know, if I was the membership chairman and someone like me dropped out of the sky and gave a speech like this about numbers, thank you. Drinks are on me really later tonight. But we all need to be part of Trent's committee because it's going to take all of us to grow this academy. It's going to take your passion. You got to mentor those young people, okay? So try tomorrow to commit to a committee. If they say we're only taking 6, go no. You tell me. Have you ever been involved on the conference committee? That takes a lot of work. Have you ever been on practice affairs? That's a ton of work. Have you ever been on the standards committee? My God, that takes a ton of work. We need people to help out. But the media and membership committee, everyone's a member now. Thanks, Trent. So I want you to be a member leader of the academy. That's my challenge to you. Take a few membership forms today when you leave. I challenge you to recruit 2 to 3 new members for the academy this year and the following year. Just think, if you each get 1 member or 2, we could be 12, 2,000, 3,000, 4,000, 5,000 members. Mentor younger clinicians, not only to complete residency and fellowships, but be involved professionally in the academy. Volunteer in your community. I heard about this volunteer PT day. I kind of laughed. I don't know. I can't tell you how many hundreds of hours I volunteer a month. But volunteer. You need to passionately influence and mentor the younger clinicians in your clinic, in your town, in your state, in this room. Network in the APTA. Run for office. Thank you, Bob Rowe, for running for the board of directors. He's now on the board, which is quite an accomplishment for the APTA. Get involved in the orthopedic section, too. We need to spread our wings more. Think differently. Let's get outside your comfort box, thinking, someone else will do it. Make a difference in the bigger picture. If we get more members, we can make a difference. That's what we want to sell, okay, within the healthcare arena. Be a political advocate. It's another thing I'm asking you to do. I'm asking you to do a lot. So what if we don't think differently? We might not survive. We're not going to have influence politically. We're going to lose our influence on post-entry level education, ABTRE, which is a whole nother lecture, which we need to stand up to and get control again in some way. Sorry, Michael, but that's the truth. Oops, I want you to work with your colleagues. And let's let mentorship define us as an organization. Not just mentoring to be great clinicians, but mentoring people to join our organization, mentor people to be involved in our organization, mentoring people to be involved in the APTA and the orthopedic section. Okay? We did this a quarter of a century ago as an academy when it was founded. Mentorship defined us. It really did. And let's get back to it, and let's keep it going.
I want everybody to get up off your seat and get your arms together and your hands together and give me some of that old soul clapping. You didn't have to love.
You know who that is?
But you did. And I thank you.
Sam and Dave.
Have to squeeze me like you did, but you did.
So, I'm winding down. I want to thank a lot of people. I'm very grateful for the selection of this very distinguished award. Awards aren't possible without great family, great mentors, great colleagues, and great friends. This is important. Edie, thank you. You're a legend in your own right. She put up with me. We've been married 36 years. She put up with my rant and raves, my competitiveness. I hate to lose. She knows that better than anyone. But she was been there with me every step of the way. and to my daughters, Shannon, pictured on the left, who was just married in April, and my oldest daughter, Jenny, for enduring a lot of absences. And there's a lot of times I wasn't home, and I wasn't at soccer games, I wasn't coaching, and I thank them. This is Mick. He likes Chardonnay. I like Cabernet. You know, I love to talk. I kind of got off track a little bit, so I've got to really close down here. But Mick and I were worried that 50 minutes wasn't long enough to get my message across to you, the audience. I guess I'm wrong. Mick stressed, Joe, be yourself. Speak from your heart. Yeah. Be passionate throughout the lecture. And I hope I've been passionate. I'm a firm believer also that awards are the product of many people. I want to thank all the fellows in training I've worked with over the last 31 years. In this photo, the bookends are faculty members Cindy Walton and Ed Schiavone and myself. Our recently graduated fellows, Cindy, Matt, Ryan, Jeff, and Andrea. Thank you so much. You don't know how you've contributed to my growth as a professional and how much I love to mentor you. I want to thank my fellow faculty members from the Kaiser Northern California Orthopedic Manual Physical Therapy Fellowship. I had to practice that a lot because we just changed our name. But I want to thank the faculty. It's been wonderful working with you, and I hope you continue to allow me to work with you. And I love our stimulating conversations. They are endless but wonderful. Carol Jo Titchener, thank you for nominating me for this prestigious award. I'd like to thank Bill Boisenall, Steve McDavid, and Dr. Lance Toomey for writing support letters. And I'm thankful that Carol Jo shared those letters. Pretty humbled by him. But Carol Jo, thanks for being a great friend. Where are you? Great colleague for over a quarter of a century. Can you believe that? How come my hair is white and yours isn't? We've worked on many projects with a tremendous passion professionally and in this organization. And just because you're retired, your work's not over. I want to thank the founding fellows for thinking different 25 years ago. You thought different for the good of our profession. I want to thank you for sticking with my leadership during the embryonic stages of our growth. To this day, I can't put in words what great friends you are and remain. Thank you. I want to give a shout out to Ola Grimsby, who's in the hospital, recovering from a sudden cardiac arrest. He's perfectly fine if you've been on Facebook, but keep Ola in your thoughts and prayers, please. I put this picture up because the early days, I want you to know that I didn't have white hair, and Carol Jo had a fro, and Cornelia Kulig, she looks the same. I mean, Cornelia's not here. Carol Jo and I have changed. But believe it or not, we were the architects of the first standards document and the application for IFOMP. And Carol Jo sat in my little office, which is about 8 by 8 in my house in Custer Valley, on a Mac Plus, writing it up. And we spent a lot of hours. So I want to thank these two ladies. But I really put this up to show that we really were young at one time. To Dr. Stanley Paris. In Rochester Hills, when we started the organization 25 years ago, do you want to know how I became the first president? I was the ad hoc first president. You want to know? Does anyone know? You don't know. Stanley and I were standing there having a leak, and Stanley's right there. He goes, Joe, I think I'm going to nominate you for the president of the American Academy of Orthopedic Manual Physical Therapists. And I go, okay. So that's how the first 8 appointed me as the first president. I want to thank all the presidents who have served for this organization. Mike Rogers, Ken Olson, who's not here, Tim Flynn, great to see you here, Bob Rowe, great to see you here, Jim Rivard, our new president. I can't thank you all enough, gentlemen, for your passion, your excitement, your tenacity, your volunteerism, and your leadership. No one in this room knows how hard it was to sit at that desk and lead a meeting or lead a meeting of 700, 600, 700 people. No one knows, but I do, and I want to thank you each. Right from here. My good friend Eric Robertson, who's the director of Kaiser Fellowship Program. Eric, thanks for all the help on the slides, for being the idea machine. He kept me modernized. I really used to just use overheads when I first started to teach. So I'm going to ask you something. How much should we grow every year? 10, 20, 25%? That's for our strategic planners to take up. But I would sincerely like to see our membership grow in the next 5 to 10 years up to about 10,000 members. We can do it if you each become a member leader and try to recruit someone. I mean it. I want everyone to come to this meeting next year with a friend, a new friend. Say, hey, I recruited this guy this year. And instead of 600 people, let's have 1,200 people next year, because you're going to bring 600 new members. Okay? Think differently. Your membership, you got to think differently about your membership now. 30% of fellows in the last 10 years didn't renew. We need to change that. Let's push to get 80%, especially when we've done renewal fellowship. We got to consider, should we keep renewal or not? That's a challenge for our organization. Okay? So, I challenge you all to bring 2 new members next year. Okay? I challenge you to mentor your colleagues in the clinic. I challenge you to become involved. I challenge you to go and learn more about committees. And right now, they should be handing out membership applications for each of you to give to a colleague in your clinic or in your community or your state. And I ask all of you to step up, think different. Don't be satisfied with the status quo. Our organization can't afford the status quo. Thank you. So, getting the standing O is really appreciative, but if you really want to contact me, you got my email there, and my Twitter account is there too. You know, I only have 12 followers, so I'm feeling embarrassed. So maybe you could kind of start following me on Twitter. Thanks for everything, guys. I really appreciate your attention.